forests scattered across Canada, scientists are tracking a full-scale invasion. They're tiny, dangerous, and once uncommon. Now the population of these ticks is growing at an alarming rate.
To find them now moving in such a dramatic fashion is quite striking to me.
So this is the enemy, Ixodes scapularis nymph. You can see how small they are.
They're bringing with them a mysterious disease that is dividing the medical community.
I felt that they were offering me a life of further deterioration, disability, and possibly ultimately death.
Soon, these foreign invaders will occupy the neighborhoods where most Canadians live. Take one bloodthirsty tick and some ancient bacteria, then stir in climate change and symptoms that mimic other diseases. What you wind up with is a compelling medical mystery and a baffling disease that could affect thousands of Canadians. It's called Lyme disease. In a Winnipeg classroom, biology teacher Kathleen Krang gives a lesson to her grade 10 students about a topic she knows all too well.
How many people have heard of Lyme disease prior to entering this school this fall? Okay, so some of you haven't. Just so you know, Lyme disease was something that I acquired, and it was a pretty serious infection that I had. I started having some symptoms in the fall of '99, and it took until July of 2000 when I was treated. So I was quite ill, almost as if you think about having any other kind of systemic infection and not being treated for 6 months. It takes its toll.
It's a much longer story for Linda Lemberg. She says she's been battling Lyme disease for 5 years without much success.
Terrible body ache, chills, sweats. Between the fatigue and the neurological symptoms, I eventually lost my ability to walk independently.
Linda says it all started in 2008 after she was bitten by a tick near her home in Toronto.
That was the departure point from my previous life because I never really was well again after that.
So how do you get Lyme disease? And what role does this tick play in how it's spread? Well, just take a stroll through a beautiful Canadian forest like this, and you may find out. Lurking in that carpet of dead leaves is the deer tick in its favorite environment. It survives by feeding on the blood of animals, and it spends its life waiting for a meal to walk by. Once the tick finds its dinner, it inserts its head through the skin, where it settles in to feed on warm blood. And that's where the real problems can begin. Deep inside its gut, the tick may carry bacteria called Borrelia burgdorferi, the cause of Lyme disease. If it feeds for a couple of days, an infected tick can pass the bacteria into the body, setting off the symptoms of Lyme disease. Epidemiologist Patrick Layton and veterinary researcher Nick Ogden spend a lot of time in the woods studying deer tick populations in Canada.
Tuck the pants into the socks here. When the ticks crawl up your leg, they don't go into the sock, they go over top. Time-tested tick technology.
In this forest outside Montreal, they're dragging for ticks. They use some fairly low-tech equipment, a couple of flannel sheets that the ticks mistake for fur or skin.
We have an adult Ixodes scapularis tick, so this is the largest of the 3 life stages.
Compared to the adult, the nymph is minute. and the larva is almost impossible to see. Here, Ogden and Layton find 2 larvae on their drag. In their search for a blood meal, these tiny ticks bury under Ogden's cuticle.
Where there's one larvae, there's usually many.
They're gone.
So they all hatch out at the same time.
The larvae usually feed on mice or squirrels. That's when they can pick up the Lyme disease bacteria. Once the tick is infected, it's the next stage that poses the greatest danger to humans. An infected nymph is so small, it can easily go undetected on the body.
So this is the enemy, Ixodes scapularis nymph. You can see how small they are. This is the first stage that has the possibility of being infected with Lyme disease.
The ticks they find are sent to their colleague Robin Lindsay in Winnipeg, who tests them for the Lyme disease bacteria. Lindsay is a leading researcher with the Public Health Agency of Canada, and he's been studying the tick and where it lives since 1989. Back then, he knew of only one confirmed deer tick population, located in Long Point, Ontario.
At that time, it was the only location in Canada where this tick could be found and studied, and that population had been known from that site for at least 30 years. So that was the beginning of my venture with these ticks.
But things suddenly changed in 2002. Deer tick populations began to pop up across Canada. First in the Maritimes, followed by Quebec, Ontario, and Manitoba. Yet another species of tick carrying Lyme disease showed up in BC.
Really, I wasn't expecting the ticks to expand the way they have. We couldn't find them for many years, and then to find them now moving in such a dramatic fashion is quite striking to me.
Ticks can only travel a few meters in a lifetime. So how are they moving in so quickly across Canada? Well, they're getting lots of help from the common yellowthroat and other songbirds. Every spring, they migrate from the south. And because these birds are ground feeders, they're an easy meal for the deer ticks, who wind up catching a ride for the long trip north to Canada. Here at the McGill Bird Observatory in Quebec, they study the migratory patterns of songbirds. If they find a tick, they send it on to scientists who check it for the Lyme bacteria.
So this is a common yellowthroat. Usually if they've got a tick, it's noticeable somewhere on the face as an engorged tick. But we can just blow at it a little bit and see if there's anything hiding. And it looks like he's clean. No ticks. And these guys are, as warblers go, they're relatively hardy. That's one of the reasons they're still here fairly late in migration. 12.5.
Some of the birds can go very, very long distances, thousands of kilometers in 4 to 5 days. Most will travel about 400 to 500 kilometers in that time.
We estimate anywhere from 150 to 175 million ticks come to Canada every year on the 3 billion passive-form or perching birds that go through Canada.
Ticks have been catching rides to Canada for years. So what has changed to allow their population to rapidly expand?
Up until recently, Canada wasn't a very good place for ticks. With climate warming, it seems that the conditions are improving for ticks, and they pass more quickly from one stage to the next, allowing more ticks to survive, essentially to reproduce.
What we're seeing is the tick filling up areas in Canada that we already have identified as being climatically suitable. Clearly, with a warming climate in Canada, then that area of suitability will expand northwards.
The tick dines on warm-blooded mammals, like deer and humans. But One of its favorite meals is a lot lower to the ground, the white-footed mouse. This tiny rodent is ground zero for the Lyme disease bacteria, and like the deer tick, it's rapidly moving north across Canada. Because this mouse is the main carrier of the Lyme disease bacteria, a tick feeding on its blood is highly likely to become infected. Then it can pass the disease on to humans. Dr. Virginie Millien has been studying climate change, the northward shift of the white-footed mouse population, and how that helps spread Lyme disease.
Yeah, I think I can see a tick just in front of the eye.
With the help of her students, Millien is collecting mice from traps they set in the forest the night before. And where there are mice, there are bound to be ticks.
We've had, several ticks on one mouse. They were over 15. I stopped after 15 because I wanted to show a student how they look like, and they were all around the ear and one after another. We predict that it's going to increase because conditions are becoming more and more suitable for both the mice and the ticks, and birds keep bringing new ticks every year. So what would happen in the past? The birds would bring ticks into Quebec, some of them with the disease, but those ticks wouldn't survive the winter because it was too cold, too harsh for them. Now, some populations survive the winter.
Buddy, 84.
Every mouse is examined and vital statistics taken. They find a tick larva feeding on the ear of this mouse. It's almost too small to see with the human eye. But not all the ticks carry the Lyme disease bacteria.
The ticks that were collected in the spring all over the southern Quebec in 2011 came up with a 10% rate of infection.
Some of the mice are outfitted with radio collars and released back into the forest. The team returns at night to track their movements and to get an idea how far they are expanding their range. So far, they're discovering mouse populations in Quebec are expanding about 10 kilometers a year, and they project by the year 2050, they will populate almost the entire province.
The truth is that birds are going to keep bringing ticks. The environment is going to become more and more suitable for both the ticks and the mice. So there's no reason why it wouldn't increase the rate of infection by Borrelia.
Leighton, Ogden, and Lindsay have conducted a study to project how far the tick will spread in the coming years.
You can chart on the map the invasion front for ticks, and you can see how it changes from year to year as they spread further north, approximately 46 to 50 kilometers a year. But the first places they're spreading are through the most densely populated areas of Canada.
In fact, they predict that 80% of the Canadian population will be exposed to the deer tick by the year 2020.
Normally when you model, it's kind of loosey-goosey and maybe it's not going to fit. The predictions that are being made are strikingly accurate. It's very, very, very interesting.
It's only been a few decades since Lyme disease was first identified in North America, and now Canadians are increasingly at risk. But how long has the disease really been around? This ancient corpse may hold some clues. On September 19, 1991, two German tourists are hiking in the Alps along the Austrian-Italian border when they come across a frozen body. What they believe to be the remains of a recently lost mountaineer turns out to be an ancient corpse preserved in alpine ice for 5,000 years. He's nicknamed Otzi, the Iceman of Bolzano. Over the next 20 years, scientists will extract many of the secrets hidden within his remains. He was lactose intolerant. He was murdered by an arrow to the shoulder. But in 2012, Otzi gives up one more startling secret. He is the first human on record to be infected with Borrelia burgdorferi. Otzi had Lyme disease. Thousands of years later, the disease will show up halfway around the world, this time in the northeastern United States. But it's not called Lyme disease yet. In fact, in the 1970s, doctors have no idea what it is. All they know is this. In the small town of Lyme, Connecticut, entire neighborhoods are falling victim to flu-like symptoms and painful swollen joints. In many cases, the illness starts with a mysterious ring-like rash, dubbed the bullseye rash. But doctors are divided over what's actually causing the illness. One group says that it's a virus, while the other side argues it's a bacterial infection which can be treated with antibiotics. It's just the first of many contentious debates that will come to plague this controversial disease. Scientists soon discover it's the deer tick that is transmitting the disease to humans. Then, in the gut of a deer tick, they isolate the corkscrew-like bacterium that causes Lyme disease. They call it Borrelia burgdorferi. Finally, it's settled. Lyme disease is caused by a bacterium, not a virus. These days, more than 20,000 cases of Lyme disease are reported in the United States every year. And in Lyme, Connecticut, it's tough to find a family that hasn't been affected.
There's no shortage of ticks. It's one of those shames because everyone thinks that this is where it was actually came from, and it's really just where it was actually discovered. And myself have had it, Emily's had it.
Our dogs have had it.
I've had it, I think, come back and treat it again and it goes away. I don't know if it ever completely leaves your system or not.
Hayden is not alone. There are others who believe the disease has not completely left their system. Doctors agree that if Lyme disease is caught in the early stages, 2 to 4 weeks of antibiotics should cure it. But some people go on to develop other, more severe symptoms. So what's going on? One side believes the Lyme bacterium can live on in the body even after antibiotic treatment. They call this chronic Lyme disease. The other side believes something else is causing the symptoms. Because this side believes chronic Lyme disease is an infection, they treat it with antibiotics in high doses and sometimes for years. And that's controversial. Dr. Maureen McShane has devoted her practice to treating people who she believes have chronic Lyme disease.
A typical patient is someone who has flu symptoms that are on and off, seeing multiple doctors, never able to regain their health, going in a downward spiral with their health. So they're having losses. For every year that goes on, they have more and more losses. It can vary from one person to the other, but a Lyme patient tends to have multiple systems involved, and they tend to be very, very ill. They tend to, a lot of times, have cognitive issues, and that's one of the reasons why I spend so much time with them.
Linda Lemberg is one of Dr. McShane's patients. She says she's been battling chronic Lyme for over 5 years.
I saw you walking by yourself down the hall, and I said, oh my goodness.
Back home in Toronto, Linda is having one of her good days. A reminder of what life was like before she became ill.
People used to wonder how I could squeeze everything into a day, because I also made time to go to the gym and go to aerobics classes, Pilates and yoga, take walks.
All of that changed in 2008 after a walk in the woods near her home. A few days later, Linda discovered a rash on her leg, the bullseye rash typically associated with Lyme disease. She wasn't diagnosed with Lyme, but her doctor prescribed a short course of antibiotics and the rash cleared up. Months later, Linda began to feel unusually fatigued.
I was really, really tired that year. I was starting to have pain in different parts of my body. I went from being really robust, physically fit, and animated and engaged to barely being able to talk on the phone, and not being able to do very much.
Bell's palsy and meningitis.
It's a story infectious disease doctor Sam Donta has heard many times before. He's been studying and treating what he calls chronic Lyme disease for over 3 decades. He says most of his patients improve with long-term antibiotic treatment.
I tell patients, if you don't have Lyme disease and I give you this treatment over the next 3 or 4 months, nothing will happen, minimal or no side effects.
So I've learned now, for example, you start with 3 months of treatment in people who had symptoms for more than 6 months or so. And we average 18 to 24 months of treatments in people who've had it for more than 3 years. The longer you've had it, the lower the cure rate. But taking all comers, we'll get 75% of people either all better or stably improved.
One is under the skin.
But many of his colleagues disagree. Dr. Gary Wormser has also been studying Lyme disease since the 1970s. He says chronic Lyme doesn't exist because there's no evidence that the Lyme bacteria live on after standard antibiotic treatment.
We have not been able to find the slightest evidence of residual Borrelia infection in treated humans. And we have looked.
And Wormser says if there's no evidence of a bacterial infection, there's no justification for further antibiotic treatment.
When you retreat these patients with antibiotics, you don't make them better. The largest studies have not shown the slightest benefit.
But the experience of doctors treating for chronic Lyme disease is quite different.
Certain antibiotics compared to other antibiotics are effective, and therefore it supports the idea that there is a persisting infection.
But Dr. Wormser believes that the use of any antibiotic for an unconfirmed infection is not only unscientific, it also poses serious risks.
Just because something is commonly done in society doesn't mean it's evidence-based, and doesn't mean it's justifiable, and in fact, it's potentially dangerous.
I share concerns about treatment with antibiotics, but I know of no other way to take care of this, and this is not unique to Lyme disease. If you have leprosy, you need 2 to 3 years to get rid of it. You have tuberculosis, it's not 1 or 4 weeks, it's months.
The division in the medical community has been devastating for people like Linda Lemberg, who believe they have chronic Lyme disease. For over a year, she was sent from one specialist to another, but no one could tell her what was wrong. Finally, in 2009, an infectious disease doctor in Ontario diagnosed her with chronic Lyme disease. He started her on a 2-year treatment, which included a PICC line for intravenous antibiotics. A few months later, her symptoms improved, but when she arrived for her next appointment, the specialist took her off all of her antibiotics.
In our final meeting, he absolutely contradicted everything he had told me. I said, well, what am I supposed to do now? Look at how sick I am. And I had found out that this doctor had pulled out all of his patients' PICC lines who were getting treated intravenously, and he had cast adrift all of his patients.
So why did this happen? Why would a treatment that seemed to be helping Linda and others suddenly be terminated? Well, most Canadian doctors follow the American treatment guidelines, which recommend 2 to 4 weeks of antibiotics for any Lyme infection. And most doctors won't treat any longer than the guidelines recommend. Doctors Wormser and Donta were on the committee that wrote the American guidelines, but were on opposite sides of the chronic Lyme debate.
One of my roles was to devise the section on chronic Lyme disease. Now, most of those committee members were of the type that didn't believe that chronic Lyme disease existed. My guidelines to the committee were not taken, so I couldn't sign that document.
As a result, chronic Lyme disease isn't recognized in the guidelines, but that doesn't stop Dr. Maureen McShane from treating it.
There are some things in life when you have to stand there and say, no, wrong is wrong and right is right. I am not going to follow their guidelines. It's totally immoral what is happening to these poor people. Totally immoral.
But is it possible that some patients are experiencing symptoms caused by other diseases?
Feet together.
It's a question that worries some physicians.
20% of the general population has chronic fatigue. 20% of adults in the United States have arthritis and joint pain. So these symptoms that people are attributing to Lyme disease are quite common in the general population, and we don't know why. In many cases, people have them.
I got involved primarily because
the debate over chronic Lyme has spilled over into Canada. Dr. Ernie Murakami has used long-term antibiotics to treat hundreds of chronic Lyme patients. But in 2005, the BC College of Physicians and Surgeons dubbed him a zealot and started to question both his objectivity and his treatment methods.
I can treat acne years at a time with doxycycline. I go 30 days on an antibiotic for Lyme. I got the riot act thrown at me.
Murakami was under intense pressure and faced a choice. Either stop long-term antibiotic treatment of patients or risk losing his medical license. In the end, he chose to retire.
In Canada, the doctors are intimidated and fearful of treating, and they're just petrified of what they've done to me could happen to them. Where you can remove all the biofilm.
But Canada's Public Health Agency says that most Canadian doctors don't believe that chronic Lyme exists. And that's why Linda Lemberg travels to Plattsburgh, New York, to get the treatment she used to receive in Canada. New York is one of 12 American states to pass laws protecting doctors who treat Lyme outside the guidelines. But Dr. McShane also treats because she was once a chronic Lyme patient herself.
If someone hadn't done it for me, I would have been in a wheelchair by now. I was having problems driving, talking, walking. If someone had not risked his license to treat me, I wouldn't be practicing medicine. And I feel it's a moral issue. I have to treat, and I want to treat.
Wow. But the national record, and this is in the U.S. for
Winnipeg science teacher Kathleen Krang wrote her master's thesis on Lyme disease. She discovered that just a few hundred kilometers away in Minnesota, Lyme disease diagnoses were proportionately higher than in Manitoba. This led her to question whether it was being missed or misdiagnosed in her home province. Lyme can mimic the symptoms of many other diseases, from fibromyalgia and chronic fatigue to multiple sclerosis. When Krang fell ill in 1999, she was told that she likely had multiple sclerosis.
I had an MRI that showed positive for some lesions, some white matter lesions that are synonymous with MS and an MS diagnosis. But ultimately, through some research, found out that the same kind of MRI results appear in certain Lyme cases.
Krang saw a doctor who diagnosed her with chronic Lyme disease, and after 6 months of intravenous antibiotic treatment, her symptoms went away.
From being basically unable to walk up the stairs in your house to, being fully active again in a short period of time is something that doesn't happen if you don't have a response to the antibiotics.
So how is it possible to test negative for Lyme but respond to antibiotic treatment? Well, the tests conducted here at the National Microbiology Lab in Winnipeg don't actually detect the presence of the Lyme bacteria. They only test for antibodies, how the body's immune system is responding to a possible infection. And there's been a lot of debate about the reliability of those tests.
Would it be nice that you could tell that a person is actively infected, that they've definitely been exposed to this pathogen, I think that would be wonderful. With every patient who submitted a sample and we could say, yes, you were infected with the agent that causes Lyme disease, or no, you weren't, that would be great. But at the present time, these are the only licensed and validated tests that we can use. I don't think in science we're that rigid. Give us a better test and we'll use it.
So why isn't more research being done to solve some of the perplexing problems surrounding Lyme disease? In fact, there is encouraging research out there. The problem is, the patients aren't human. The Gertson family from Vancouver has just arrived in Redwood, California. But this isn't a family vacation. They're here for a doctor's appointment.
This is our war book because fighting Lyme is like a war. So we have phone consultations with Dr. Harris. These are just all notes, correspondence between us and the doctors, and treatment plans.
It's been a long, hard road for Mom, Shannon Gertson. She is in the United States because her doctor in Canada was reluctant to continue treating her for chronic Lyme.
He at one point began to yell at us and said, "You have no idea how much heat I'm taking from my colleagues for treating you." He told me that if I had Lyme disease to begin with, that I would be better at the end of 3 months. And because I wasn't, I don't have Lyme disease, and he did not ever want to see me again. He told me never come back. He had really good.
So over the past 5 years, Shannon has run up over $100,000 in medical bills. Her American physician, Dr. Stephen Harris, has had her on intravenous antibiotics for 4 years.
Your blood flow's better than usual. Because usually you're red and clammy. But now Shannon is generally living a normal life. Was it Lyme that started the insult and is now no longer present, but that there's still some of the damage that was done? Or is there the infection that's still in its various manifestations? And that's unknown, and this is where the debate comes in.
And Shannon isn't the only member of the family getting treatment from Dr. Harris. Her 13-year-old son, Parker, is with her because in 2009, Dr. Harris diagnosed him with Lyme disease.
Is it still that situation where you have some days that are good in between bad days, or is it like every day's bad?
Every day is bad.
When he came in, he couldn't walk. He was in a full wheelchair. He was emaciated. Looked like a concentration camp survivor, to be quite honest. He was sick and wilted and sad.
Shannon believed Parker had chronic Lyme disease. His Canadian doctors did not.
Sometimes they would just basically right away say, "Oh, you're faking it, you just don't want to go to school," and they just kick us out right away.
Then his vision started to become blurry, so he was seen, or waiting for an MRI.
I can't justify not treating them if the treatment is working for them, even if the science hasn't caught up with that.
Back at home in Vancouver, it's a typical Sunday. And there's a third member of the family here who may have contracted Lyme disease. When Harrison, the family pet, became ill, Shannon took him to their vet.
The vet examined him. He said, "It's a tick bite, and we treat tick bites with antibiotics right away." I said, "Does Harrison need to have a Lyme test?" And he said, "The test isn't very reliable." He said, "I can order it for you, but if I was you, just take the prescription and treat your dog, because if your dog gets chronic Lyme disease, it's a whole other ball game and they get really sick, and I just want to prevent your dog from getting that." Wow.
Okay, can I just go now?
It doesn't make sense. How can I have a child that is so debilitated by the disease that he's in a wheelchair, can't feed himself, can't go to school, can't be normal and can't get treatment. And yet I can take my dog and without blood work have him treated.
So do veterinarians know something that medical doctors don't? Here in Northern California, the tick that carries Lyme is common in most counties. At the University of California in Davis, veterinary scientists Nicole Stevenson and Janet Foley are looking at Lyme disease in pets and their owners.
Dogs are fantastic sentinels for human disease because dogs actually reflect what's happening in your home.
Part of what we hope to find is how well we can predict the risk of tick-borne disease in humans from using data from domestic animals.
So today, they're not just taking blood from dogs, they're also testing their owners for Lyme disease.
A recent study said that dogs are 6 times more likely to get Lyme disease in endemic areas than people are.
That would suggest we're seriously underdiagnosing human cases. And so that's one thing we want to find out is that true? Are there human cases up there that are not being diagnosed?
Across campus, senior veterinary researcher Stephen Barthold is also studying animals to understand how the Lyme bacteria operate once they're inside the body.
Greater than 70%, closer to 80%, I suppose, of human infectious diseases are of animal origin. Animals are rich with opportunity for studying human disease.
He's been studying the Lyme bacteria in mice and other animals for more than 3 decades, and what he's discovered worries him.
We can treat animals with antibiotics during early infection and effectively cure them of infection. If we wait until that mouse is chronically infected and treat with antibiotics, 100% of those animals remain infected after treatment.
In other words, animals that were treated early recovered, but if treatment was delayed, the Lyme bacteria lived on, even after antibiotics. Still, the question remains, could the bacteria also persist in humans?
It certainly does in dogs, it certainly does in mice, and it certainly does in monkeys. I leave it to you to guess whether it occurs in humans or not.
But Dr. Gary Wormser says that no American study has found live bacteria in humans after treatment with antibiotics.
We can't find any evidence of residual infection in humans by culture, by PCR, or by any test that we've tried to do in the United States. It's always concerning if you're drawing inferences from animal studies when you have human studies. You would think that you would use the human studies as the first line of evidence.
Why ignore the preponderance of evidence that this is happening in a spectrum of species with a variety of different antibiotics in a variety of different laboratories? I think there's a certain amount of truth there. What all of this persistence means after treatment, further studies are needed.
Will the mystery of Lyme disease ever be solved? Or will the same thing happen in Canada that has happened in the United States, where the chronic Lyme controversy has turned into a heated political battle? With climate change, Canada is becoming a more welcoming environment for the Lyme disease-carrying deer tick. No one knows exactly how many Canadians have contracted Lyme disease because mandatory reporting only began in 2009. But as the tick expands into the most heavily populated areas of Canada, the number of cases is expected to rise.
The sense of urgency that we're seeing that the populations are expanding and not into parks or to nature reserves, they're expanding into neighborhoods. This is going to be fundamentally the new reality.
So what do Canadians and their doctors know about this future reality?
If you were just to pull anyone off the street, some people may not have even heard of Lyme disease.
And others who have would say, oh, it's pretty rare.
There are doctors after doctor after doctor that tell my patients they can't have Lyme disease because it's not in Quebec or because there's no deer in the neighborhood. I mean, there is no way.
And even if they have heard of Lyme disease, most doctors follow the American treatment guidelines. So will we eventually set our own?
We need to write our own guidelines, and that process is underway. But for the time being, I think we're going to rely on the expertise south of the border. I'm not saying that it's absolutely correct, but at the present time, the weight of evidence suggests that chronic infections don't occur.
So people like Linda Lemberg continue to leave Canada seeking the treatment that only a handful of American doctors are prepared to offer.
I should be able to get treated here. I think everyone should be treated here, and it should be covered by our medical health care system.
But if nothing changes as the deer tick invades the Canadian landscape, will our political landscape start to look like this? In parts of the U.S. where Lyme disease is common, patients who feel they are being ignored have taken to the streets in frustration.
If I were in their shoes, I wouldn't know what to do either. They're being told different things by different doctors. There's so much dogmatism, so much mistruth. It's polarized in the lay community, it's polarized in the medical community, and unfortunately it's now polarized in the scientific community. And it's not the way it should be.
None of this is really going to go away until somebody comes up with what these patients actually have and finds a therapeutic intervention that makes them feel better. And my heart goes out to them. They're suffering.
New tools to better understand the cause of that suffering are now being used by researchers at the University of British Columbia. Dr. David Patrick is leading a study using gene sequencing to look at Lyme and other chronic diseases.
We are at the dawn of an age when we can look at things completely differently. It's like looking under the microscope for the first time and saying, what do we see now with these tools that we couldn't see before? Between 1880 and 1898, we discovered the causes of easily 20 major human diseases that had been bothering people for thousands of years, just by applying the new tools to old diseases. TB, cholera, typhoid, those were all solved within 18 years with new technology.
And there's hope the new gene sequencing technology will do the same for chronic Lyme disease. Dr. Patrick's study looks at blood taken from human subjects. Foreign DNA will be separated from the patient's DNA, allowing researchers to see what disease-causing organisms are lurking in the bloodstream. And in the future, they can do the same with human tissue. It could be decades before patients realize any benefits from the current research, and the controversy over chronic Lyme disease is finally settled. In the meantime, as the invasion continues, Canadians will have to adapt to the increasing risk they face from infected ticks.
We take basic precautions, tucking our pants into our boots and doing a thorough tick check when we get home. And if any signs of infection develop, then go to your doctor quickly to make sure that you get treatment early on. Those are really the main precautions that anyone in the public and researchers included can take to prevent Lyme disease.